Thank you for viewing this webcast. Today I am going to discuss tobacco and nicotine-free childcare and how to implement a gold standard policy. Please see the attached document in the training registry. It is a sample policy for your organization. Please fill out the evaluation when you are finished viewing this webcast. It is a separate link and it is a requirement in order to receive your certificate of completion. You must participate in the evaluation. Today I will provide an overview of the American Lung Association, define tobacco products, provide tobacco education, and information on updating a tobacco and nicotine-free policy, and then provide resources. After this presentation, you will be able to define tobacco and nicotine products, define secondhand and third-hand smoke, list health effects of secondhand and third-hand smoke, understand the components of a comprehensive tobacco and nicotine-free policy, and implement and enforce a strong, comprehensive tobacco and nicotine-free policy. The American Lung Association in Iowa serves as a community partner for the Iowa Department of Public Health Division of Tobacco Use Prevention and Control Grant. The American Lung Association serves Polk, Dallas, Jasper, Marshall, Warren, Madison, Union, and Adair counties. Tobacco and nicotine-free childcare facilities and homes is a nationwide and statewide initiative. There is an Iowa Department of Public Health community partner in every Iowa county. You can go to this site to find your CP, or you can feel free to contact me after you view this webinar, and I would be happy to connect you with a community partner in your county. We would truly welcome the opportunity to present to your staff about tobacco education, and we would also welcome the opportunity to present and meet with your parents of your centers. Now I want to define tobacco for you. Tobacco is a plant which is used to manufacture tobacco products. Tobacco products are any product made or derived from tobacco, such as nicotine, that is intended for human consumption. This includes any component, part, or accessory, cigarettes, electronic smoking devices, cigarette tobacco, roll your own tobacco, smokeless and dissolvable tobacco. It does not include nicotine products approved by the U.S. Food and Drug Administration for tobacco cessation. Electronic smoking devices are any device that can be used to deliver an aerosolized solution that may or may not contain nicotine to the person inhaling from the device. This includes e-cigarettes, e-cigars, e-pipes, vape pens, e-hookahs, or other simulated smoking devices. And the definition of nicotine is a chemical that acts as a stimulant in small doses. It is toxic in large doses and is the addictive component of tobacco. Here are some examples of tobacco products. There are combustible cigarettes on the top left. The top middle picture is of little cigars or cigarillos. The far right picture is a hookah or tobacco water pipe. The bottom left picture is smokeless tobacco, also called chewing tobacco. The bottom middle pictures are of snus, chewing tobacco in a packet that does not require spitting, and the last picture on the bottom right is of flavored cigars. Dissolvable tobacco products are mints, sticks similar to toothpicks, strips similar to Listerine mints, and orbs similar to Tic Tacs. You can see in these pictures that the dissolvable tobacco products and the alternative tobacco products look similar to everyday candy and mints. You will notice that none of these are childproof or have childproof packages or containers. Here are examples of electronic smoking devices. If you employ teenagers or young adults, this could be a common concern since usage is very common among these age groups, although all age groups do use electronic smoking devices. You would not want employees to have these products on them or in their purse at work in case a child could get within reach of it. You especially would not want them to be used in the centers, and currently, they would not be included in your policy unless explicitly stated. Mainly because these are fairly new products, and current DHS rules and the Smoke-Free Air Act have not been updated to include these products. According to the FDA, electronic cigarettes or electronic smoking devices are devices that allow users to inhale an aerosol containing nicotine or other substances. Unlike traditional cigarettes, e-cigarettes are generally battery operated and use an atomizer to heat a refillable cartridge that then releases a chemical-filled aerosol that is inhaled into the respiratory tract and lungs. Studies find that electronic smoking device users' average length of puff to be significantly longer than a conventional cigarette. These two products are used differently. With being battery powered, this can result in a huge variability in the product's ability to heat the solution. It may affect the nicotine delivery and formation of toxins in emissions. Electronic smoking devices are often available in flavors that appeal to children and teens, including Fruit Loops, cotton candy, bubblegum, chocolate, strawberry, and mint, just to name a few. There are over 7,000 different flavors of electronic smoking device liquid nicotine on the market. The electronic smoking device is the only device besides cigarettes that delivers tobacco directly to the lungs. This means that the nicotine reaches the brain much faster than other products, and the concern is that this will encourage the addiction or enforce the addiction. FDA-approved treatments do not deliver nicotine directly to the lungs. They are controlled doses, and healthcare providers know how to dose them in a safe, effective manner for patients that want to quit. Nicotine is a drug. When it is used and it only takes one puff, it increases heart rate, respiratory rate, blood pressure, releases glucose in the bloodstream, and slows the production of insulin in the pancreas. So what does that mean? It can lead to heart disease, lung disease, and hyperglycemia, or high blood sugar. And these problems can lead to even worse medical conditions. So using any product that delivers nicotine into the body can be dangerous, especially with long-term use, and especially with conventional cigarettes and electronic smoking devices containing so many other chemicals. Electronic smoking devices use a lithium-ion battery. There have been many reports of these devices exploding on the charger and while in use because of cheaply made, unregulated products and because there can sometimes not be a charging override, so the device can overheat, again when poor manufacturing standards are used. The two main components of electronic smoking devices' liquid nicotine solution include propylene glycol and vegetable glycerin. Propylene glycol is a form of vegetable glycerin. The FDA has approved it for topical, oral, and injectable medications and as a food additive. Common uses are a pharmaceutical solvent, food additive, moisturizer, hand sanitizer, non-toxic antifreeze, aircraft deicer, and deodorants. Vegetable glycerin is extracted from vegetable oils. If it's inhaled, it can cause mucous membrane irritation leading to wheezing, swelling of the tongue, nausea, and upper respiratory infections, according to several studies. Common uses are as a natural preservative, cosmetics, acne and skin creams and ointments, replacement for alcohol and herbal tinctures, and as medication, suppositories and eye drops. Electronic smoking devices also contain tobacco-specific nitrosamines, and these have been shown to cause cancer. There are many concerns with electronic smoking devices. The concerns for adults are that the long-term health effects are not yet clear. These could perhaps cause a relapse in former smokers. These devices renormalize the use of cigarettes, delivers nicotine directly to the lungs like cigarettes, and these devices are often used as a way around tobacco and smoke-free rules. The concerns for children and teens are the easy access. They can be gateway drugs to regular conventional cigarettes and other products. They're flavored, being marketed towards young people. They increase the risk of addiction, abuse, and serious overdose, and they're often used as a way around tobacco and smoke-free rules. These are a concern to young children because of nicotine poisoning and secondhand aerosol emissions. Nicotine is an acute toxin. Exposure to nicotine through cigarette butts, e-liquids, or other tobacco waste can cause nausea and vomiting, respiratory arrest, seizures, and even death. Ingesting tobacco products is a major reason for toxic exposure in infants and children, reported to Poison Control Centers. Please have information on the Iowa Poison Control Center at your center or home. A 1-year-old child died from liquid nicotine poisoning in December 2014, the first such death in the United States. The liquid nicotine bottles are sold in various sizes, from 10 milliliters, only about 2 teaspoons, to more than 30 milliliters, about 6 teaspoons, and come in a variety of nicotine strengths. 1 teaspoon of concentrated liquid can be fatal to the average 26-pound toddler. Nicotine poisoning symptoms include vomiting, a fast heart rate, jittery and unsteady appearance, difficulty breathing, and increased saliva. Tiny amounts of e-juice, whether it's ingested or absorbed through the skin, can cause vomiting, seizures, and be lethal. E-cigarette device and liquid nicotine reported exposures to poison centers. In 2011, it was 271. In 2016, it was 770. In 2014 and 2015, we saw a huge spike in the 3000s, and 2016, this report was at the beginning of the year. The term exposure means someone who has had contact with the substance in some way. For example, ingested, inhaled, absorbed through the skin or eyes. Not all exposures are poisonings or overdoses, and the majority of these cases have been with children under 6 years. Now I'm going to provide education on secondhand and thirdhand smoke. Secondhand smoke is also called environmental tobacco smoke. It is a mixture of 2 forms of smoke that come from burning tobacco. Mainstream smoke, which is the smoke exhaled by a smoker, or side stream smoke, which is the smoke from the lighted end of a cigarette, pipe, or cigar, or tobacco burning in a hookah. This type of smoke has higher concentrations of cancer-causing agents, also known carcinogens, and is more toxic than mainstream smoke. It also has smaller particles than mainstream smoke. These smaller particles make their way into the lungs and the body's cells more easily. Third-hand smoke is residual nicotine and other chemicals left on a variety of indoor surfaces by tobacco smoke. Studies show that third-hand smoke clings to hair, skin, clothes, furniture, drapes, walls, bedding, carpets, dust, vehicles, and all other surfaces that can absorb, even after smoking has stopped. Infants, children, and non-smoking adults may be at risk of tobacco-related health problems when they inhale, ingest, or touch substances containing third-hand smoke. Third-hand smoke residue builds up on surfaces over time and resists normal cleaning. Third-hand smoke cannot simply be eliminated by airing out rooms, opening windows, using fans or air conditioners, or confining smoking to only certain areas of a home. Now I'm going to provide information on women in pregnancy concerning smoking and tobacco use. Women who smoke during pregnancy are more likely to have infertility before pregnancy, and issues with infertility, loss of pregnancy and bleeding, complications with the placenta, preterm labor, and preterm birth. The chemicals and toxins from smoking are passed to the baby, and carbon monoxide prevents the baby from getting the necessary nutrients and oxygen. Non-smokers who breathe in secondhand smoke take in nicotine and toxic chemicals. The more secondhand smoke you breathe, the higher levels of these harmful chemicals in your body. So it is best for pregnant women to avoid secondhand smoke. Babies who are exposed to smoke during pregnancy or exposed to smoking are more likely to have a low birth weight, increased heart rate, decreased lung, heart, and brain development, colic, cleft lip and palate and other birth defects, ADHD and learning problems, asthma, ear infection, bronchitis, pneumonia, and other upper respiratory infections after birth. Nicotine is a stimulant, so any product that contains nicotine can increase baby heart rate, blood pressure, temperament, and heart development. A 2003 study suggests that babies of mothers who smoke during pregnancy undergo withdrawal-like symptoms similar to those seen in babies of mothers who use some illicit drugs. For example, babies of smokers appear to be more jittery and difficult to soothe than babies of non-smokers. Infants and young children who are exposed to secondhand smoke can experience similar negative health effects. Decreased lung, heart, and brain development, colic, ADHD, learning problems, behavioral issues, asthma, ear infection, bronchitis, pneumonia, and other lower respiratory infections after birth. Harmful chemicals remain on countertops, upholstery, carpets, floors, clothing, car interiors, and other fabrics and surfaces for days, weeks, and even months after a cigarette has been smoked. This includes toys, blankets, and car seats. Children are exposed to third-hand smoke as they breathe, near, crawl, and play on, and touch and put in their mouths surfaces and objects that are contaminated with third-hand smoke. Low levels of toxins can build up to dangerous levels in the body. Babies and young children breathe in the toxins and can experience the same negative effects as secondhand smoke. The tobacco education I have provided so far truly makes the case for creating tobacco and nicotine-free environments in your business. So why is it so important for childcare to be smoke-free 24 hours a day, 7 days a week, indoor and outdoor, to protect children from secondhand and third-hand smoke? Why is it important to have a tobacco-free policy and nicotine-free policy and not just smoke-free? To protect children from secondhand and third-hand aerosol of electronic smoking devices, reduce the chance of nicotine poisoning, and provide a good example of healthy behaviors because children model the behavior they see. Having strong written policies just makes good sense, but it also can strengthen your Iowa QRS and ChildNet certifications. Is there support for tobacco and nicotine-free childcare? Yes. The National Health and Safety Performance Standards for Early Childhood Care and Education recommend a tobacco and nicotine-free policy. The Department of Human Services and Iowa Administration Code 109.10 and 110.5, and the Iowa Department of Public Health and community partner organizations. Lastly, parents. Parents want their kids protected from tobacco and also want a healthy example set for their kids when they're at childcare. Here is an overview of the Iowa Smoke-Free Air Act concerning childcare facilities and homes. The Smoke-Free Air Act prohibits smoking in childcare facilities and childcare homes at all times. The law does not make a distinction between licensed and non-licensed facilities and homes, so everyone must follow this rule. Smoking is prohibited at all times anywhere within a child care facility. Smoking is prohibited at all times whether children are present or not. Smoking is prohibited in any vehicle owned, leased, or provided by the owner or manager of a child care facility or home. Smoking is prohibited in a private residence when it is used as a child care facility or child care home at all times, whether children are present or not. The Smoke-Free Air Act requires the posting of no smoking signs to inform persons they are entering a non-smoking place. Signage requirements can be found on the Sign Requirements fact sheet on the Smoke-Free Air Act website. In addition, the Iowa Department of Public Health or your community partner can provide no smoking signs to you for free if you still need some. The Iowa Department of Human Services implemented the following rules, which apply to child care facilities and child care homes as part of Iowa Administrative Code Chapters 109.10, 11, and 110.51. Smoking and the use of tobacco products shall be prohibited at all times in the center and every vehicle used to transport the children. Smoking and the use of tobacco products shall be prohibited at all times in the home and in any vehicle in which children receiving care in the home are transported. Smoking and the use of tobacco products shall be prohibited in the outdoor play area during hours of operation. There are three major reasons to implement a strong and comprehensive tobacco and nicotine-free policy at your preschool, daycare, or childcare home. First, you need to be compliant with the Smoke-Free Air Act and DHS rules and regulations as they pertain to childcare facilities and homes. But also to prevent children's exposure to smoke, as well as prevent them from nicotine poisoning if they were to reach a tobacco product or swallow a tobacco product or tobacco product waste. Prevent children's exposure to tobacco products to promote healthy social norms and healthy behaviors. Tobacco and nicotine-free policies are a priority because employees that smoke may replace their cigarettes with smokeless tobacco or non-FDA approved nicotine products during times when smoking is prohibited. A great example is an employee might switch to an electronic smoking device. Health advocates do not recommend smokers trading one addiction or tobacco product for another. We have been referring to tobacco and nicotine-free policies to be sure to be comprehensive and address the latest trend of electronic smoking devices. There are 7 FDA-approved medications for tobacco cessation. These come in the form of patches, gum, nasal sprays, inhalers, lozenges, and prescription medications, including Chantix and bupropion, an antidepressant to help curb withdrawal symptoms. Electronic smoking devices are not approved as a cessation method or as a way to help adults quit. The second case to make is for health. Currently, a little less than 1 in 5 adult Iowans smoke. The chart here shows that the adult Iowan smoking rate is 19.5 in 2013. This has since come down to 17.7 in Iowa from the most recent Briffis study. Making the case for health is that smoking is the leading cause of preventable death and disease in the U.S., worldwide, but even here in the state of Iowa. Nearly 1 of every 5 deaths each year in the United States is tobacco-related. Lung cancer is the leading cancer killer in both men and women in the U.S. 1 in 16 men and 1 in 13 women will develop lung cancer during their lifetime. Smoking, including exposure to secondhand tobacco smoke, causes 87% of lung cancer cases. COPD is the 3rd leading cause of death in the United States. 1 in 10 people with lung disease have never smoked. These statistics are nationwide statistics, but portray the picture in Iowa as well. Implementing a comprehensive tobacco and nicotine-free policy for your environment, for your center, for both the employees and then for the visitors and parents, and to protect the children, creates a safe and healthy work environment, demonstrates your childcare cares about safety and health. All children, visitors, and employees are protected from secondhand smoke exposure. Policies motivate tobacco users to quit, and policies enhance overall health and wellness. According to the Community Preventive Services Task Force, tobacco and nicotine-free workplace policies reduce consumption by continuing smokers, increase smoking cessation attempts, increase the number of smokers who successfully quit, and reduce the prevalence of tobacco use among workers. In Iowa, $1.28 billion are spent per year on healthcare costs as a direct result of smoking, and $1.2 billion is lost in productivity. Tobacco users cost employers in terms of increased sick days, reduced productivity as a result of the nicotine addiction, missed work time due to smoke breaks, and increased healthcare expenses. A recent study found that for every smoker that quits, an employer can save between $3,000 and $10,000 annually. Having this policy can convey a positive image and be great for marketing. Direct healthcare costs can be reduced, as well as reduce workers' comp claims and increase resale of building or business. It also would ensure receiving your deposit back on rental spaces. It's possible to negotiate lower health, life, and disability coverage, reduce maintenance costs, reduce fire risk, less sick days, and increase productivity. We now know why and how a comprehensive tobacco and nicotine-free childcare policy will benefit you as an employer, but the big question is, how do you actually go about making this policy change? And that's where we come in. One of the biggest questions we get is when should we make this change and how? It really comes down to a few simple steps and a detailed timeline. We have a sample worksite toolkit, which can provide a sample timeline, and we can also look at your individual organization. If you are the only employer of your organization, of your childcare, it's much easier to implement this in a short time. If you have several employees, and especially several employees who use tobacco, you'd want to give a little bit longer of a timeline to give them plenty of notice about this change and provide support to them along the way. So you want to determine messaging to remind employees, visitors, and most important parents about this policy, and then select your date it's going to go into effect. You can review your health insurance and any change opportunities if you have tobacco cessation product coverage versus not, and looking into your health insurance. And you can always receive ongoing support from the Iowa Department of Public Health Division of Tobacco Use Prevention and Control, or your community partner, which includes us, the American Lung Association, for education, enforcement, and signage. A huge piece of the implementation process is to provide employee education on what the policy entails and when it will take effect. Educate, educate, educate. Include information in your newsletter, include signs for parents. You can even have parents and employees sign a copy of the new policy saying that they received it. And you will definitely want to remove any smoking ashtray receptacles or smoking designated areas when this policy goes into effect. Many employers we work with are concerned about staff dissatisfaction. And rarely would a staff member quit over this. They adapt just like any other change in policy, and their health can be improved because of it. So when it comes to implementation, you want to provide employee education on tobacco use and secondhand smoke. do the policy change and how that affects the employees, provide parent, visitor, and new employee education, as well as providing vendor, partner, and community education. And then lastly, after you remove all the designated smoking areas, you can hang the signage when the policy goes into effect. So here's what you need to know. A gold standard policy contains these components for childcare. The policy must extend to all types of tobacco, nicotine, and electronic smoking device products, not only cigarettes, but include all nicotine products not approved by the FDA for tobacco cessation. The policy must extend to all employees and visitors, so anyone on the property. The policy must apply at all times, including school-sponsored and non-school-sponsored events. The policy must extend to school vehicles and personal vehicles while on the property. The policy must extend to the entire childcare property to be eligible for signage. And the policy must address enforcement. We recommend a progressive discipline process just like any other policy enforcement for the employees, but also must address who will do the enforcement and enforcement for visitors. Understanding in-home childcare providers may have a different situation, so each situation will be unique and deserves a unique policy. This is the gold standard policy, but if you're an in-home childcare provider and this doesn't necessarily fit your needs, please contact your community partner. Please contact me with my contact information at the end, and we would be happy to write a policy that maintains the integrity and the recommendations while fitting your business. We want to provide some resources. We can provide a policy implementation timeline, a step-by-step guide, sample communication pieces, sample policies. We can provide information on different tobacco cessation options and provide signage. We want to provide some different cessation resources, but today we're going to talk about Quitline Iowa. Quitline Iowa is a free telephonic coaching program where an individual who's trying to quit tobacco can work with a quit coach. Quitline Iowa is available 24/7. The phone number is 1-800-QUIT-NOW, and the website is www.quitlineiowa.org. Phone coaches are available to provide many different coaching sessions over a length of time, as well as unlimited inbound calls for the people that are trying to quit smoking that are really dealing with a lot of cravings and barriers. They can call Quitline anytime to receive support. Quit support is available via the web, text messaging, and emailing. An easy-to-follow workbook will be sent to people who participate in Call Quitline Iowa. And quit coaches can help provide information on picking the best tobacco cessation aids and quitting aids. Increasing the number and types of interventions in quitting smoking and tobacco results in an increased opportunity for successfully quitting. I also want to mention Lung Helpline. The American Lung Association has a national helpline that parents can call if they have any information about any lung health conditions. So this is not specific to quitting smoking. This would be a great resource for child care centers or parents who have children with lung health issues, for example, asthma. So Lung Helpline is staffed with nurses and respiratory therapists to help answer any questions about any lung health topic. Now, please fill out this evaluation to receive a certificate of completion. You will want to visit surveymonkey.com/required eval in order to receive your certificate. So just to summarize, a tobacco and nicotine-free comprehensive policy creates a positive company image, protects non-smokers and children from the effects of secondhand smoke, and helps your employees that use tobacco quit. When implementing a policy, it's really important to think about protecting the health of children. We would love to meet with each of you individually and create a plan that fits your organization's needs. Or again, you can contact me to receive your community partner name as well as any questions you may have. You may contact the American Lung Association at 515-309-9507, or you can email umiowainfo@lung.org and we can get you connected. Thank you so much for viewing this webcast.